Okay, we are live.
Okay, hi everyone. Welcome back to another session with Fresh Dental Shadowing. Today we have Dr. Daultani, and she's a periodontist, implantologist, and laser specialist. So yeah, take it away whenever you're ready, doctor.
Yeah, good evening, everyone. It's right now 11:30 p.m. in India. I should say I'm really thankful to Fresh Dental Shadowing for giving me the opportunity to present and share my experience as a periodontist. So to begin with, let's go ahead. I will be next. I'll be covering the topic under following contents: introduction, background, achievements, what a typical day is like, all about periodontology and its terminologies, the cases, and take-home message. I am Dr. Mohini Daultani. I have completed my master's in periodontist and implantologist. Very recently, I have also received my fellowship from World Clinical Laser Institute, USA. Next. Yeah, this is the one that I've received the fellowship right now. That is called as Associate Fellowship of Laser Dentistry, affiliated by World Clinical Laser Institute, USA. I've completed my graduation and post-graduation from the same college, that is Krishna Institute of Dental Science, Harar, in 2012. Masters. Next. Yeah, so I would just not like to share my personal only qualifications, but also my personal lifestyle here. In 2016, I completed my master's. In 2017, I was married. And in 2020, I was a mother of a child. So being a girl, it's not only about your career, it's also about personal life and its commitment. So this is how the life is, especially for girls, because there is so much of drastic changes before and after marriage. Next. I am presently a consultant at Apollo Hospital and various private clinics across Navi Mumbai. I am very passionate about painting. I would just like to share paintings with you so that you just have an idea about it. So these are the paintings. In watercolors, two paintings are there. Yes, these are the sketches done. Next. These are also the sketches done by me. Yes, so these are all is what I've done, and I'm very passionate about my sketch and watercolors and painting also. Next. Now I'll be discussing about also have to do few community services in your dental schooling. No? So as like we conduct free dental checkup camps are conducted for next. Because of COVID era, we could not do any offline lectures, so online lectures were given for oral hygiene awareness for various groups. Next. Now coming up to my achievements, there are few achievements I've received and I'd really like to share with you. Next. I am a brand ambassador at Dental Reach Digital Magazine. Next. I'm also associate editor of journal that is Contemporary Research Journal of Multidisciplinary Sciences. I'm also author of a book titled Fundamental of Lasers in Periodontics. Next. Also the other book that is Basics of Laser in Dentistry. Recently, I was invited as a speaker for Dental Reach Dental Divas Summit 2021. Now coming up to clinical case presentation. Next. There are various clinical cases that I've presented and I've received prize. This was the first prize that I'd received for DRDC International Conference 2020. Next. This is the first prize that I'd received at Global Outreach Medical Health Association 2020. Next. This was the silver award that I had received at Dentoscope Academy for presenting the clinical case in aesthetic category. Next. Now coming up to the articles published. Articles form a very essential part in your dentistry. That is something that adds up to your CV. So during your dentistry, you should surely publish articles that helps you in your future thing. Next. This is the original study that I had done. That is a study to assess and correlate osteoporosis and periodontitis in selected population of Maharashtra. And this is a PubMed indexed. Next. This is also PubMed index. Evaluate the efficacy of gingival pigmentation procedure using conventional scalpel technique or diode laser. Next. This is also PubMed indexed, a prospective cohort study to assess and correlate the maternal parental status with their pregnancy outcome. Next. This is also original article, the prevalence of recurrent aphthous stomatitis in western population of Maharashtra. Next. This is also original case report, desquamate of gingivitis, a clinical sign in mucous membrane pemphigoid. Next. Oral candidiasis in diabetic patient, a case report. Next. These are the few articles that published in the Dental Reach Digital Magazine. Mouthwash, the best shield of your oral cavity. Next. White fungus, all you need to know about. Next. Now coming up to the other session of my life that I do a lot of online webinars. Due to COVID right now, we are not able to take the offline workshops. So we conduct online webinars. Next. Yes, I had presented all the perio topics for all the weekends at Chess Academy in the month of May. Next. Yeah, even at Dental Udan Academy, we had conducted an online series with them. Next. At KP's Academy. Next. I was very fortunate enough to get an opportunity to present a Patinar at Global Summit 2021. Next. I have also done dental shadowing at Arushi Dental Club. Next. And at Virtual Dental Shadower. Next. Coming to the awards that I've received, there are a few awards that I would like to share with you. Next. I had received Budding Dentist of the Year by FamDent Excellency in Dentistry Award 2019. This is considered as an Oscar in India, Dental Oscar in India. Next. Emerging Speaker of the Year by Indian Health Professional Awards. Next. Periodontist of the Year, runners-up by Indian Dental Divas Award 2020. Doctor's Excellency Award by Genesis World Record 2020. Next. Top Top 100 Doctors Award by Doctor's Choice Award 2020. Next. The national winner as well as the city winner was awarded to me by DCA 2020. Next. This is the Periodontist of the Year award I had received my Family and Excellency Award in 2021 recently. Next. Now coming up to the course conduction, I also conduct online courses regarding to my subject. Next, we have done a course conduction on suture and suturing material at Buddy Dental platform. Next, fundamental of flap surgery is basic and beyond. Next. Now coming up to what a typical day is like for me. Next. Initially, I have morning session. I have to do the OPDs, and then also I'm lined up with all the periodontal surgeries. Also, besides that, I keep on writing articles, and also I conduct online courses. Last but not the least, as I'm a mother of a child, I have to also give time to her, and that is how my day is like as a periodontist and as a mother. Why I became a periodontist was next. I had a lot of love for my surgery and implant. I realized at the end of my final year that my inclination was more toward surgery. That was the reason I opted for being a periodontist. Next. All about periodontology. I'll be discussing all about periodontology here. Next. A smile is a reflection of your confidence, kindness, communication, joy, success, and affection. So it is not only determined by the structure and shape of teeth, but also by your gingival harmony. Next, I basically feel gums are something that is more avoided by the people. We do not take care, but I should say it's a small pink tissue, but can make a very big issue if neglected. Next. So what is periodontitis? It is a group of inflammatory condition of supporting tissues of teeth caused by a group of specific microorganisms resulting in progressive destruction of periodontal ligament and alveolar bone. The terminology used in periodontist is next flap. So flap is a section of gingiva that is surgically separated from underlying tissue to provide visibility and access to the underlying bone and root surface. Scaling and root planing are also known as conventional periodontal therapy that involves removal of dental plaque and calculus on tooth as well as the root surface. Coming up to the next terminology, that is frenum. It is a skin or mucous membrane fold that supports or restricts the movement of part or the organ. Gingival depigmentation is a periodontal plastic procedure where the gingival hyperpigmentation is removed by various techniques. So what is pocket? Periodontal pocket is defined as pathological deepening of your gingival sulcus. Recession is the exposure of teeth by apical migration of your gingiva. What is furcation? It is invasion of your bifurcation or trifurcation of multi-rooted teeth invaded by periodontal disease. Coming up to the next, that is peri-implant mucositis. If you have inflammation of your gums around tooth, that is called as gingivitis. And if you have inflammation of gums around implant, that is called as your peri-implant mucositis. You will have loss of your supporting bone following initial bone remodeling, and this is entirely a reversible condition. Next. Next, coming up to peri-implantitis. If you have inflammation of your gums and bone around tooth, that is called as periodontitis, and you have inflammation of your gums and bone around implants, that is called as your peri-implantitis. You will have bleeding on probing. The probing depth will be more than 5 millimeters. You will have suppuration present. Next. So what are the common complaints of the patient visiting to my clinics are? Next. They approach for bleeding and inflamed gums. Next. They have the complaint like bad breath and loose teeth. Next. Patient also report to me with tongue tie and high frenal attachments. Next. They also come with black gums. They also report to us with lot of yellow teeth. They also come with single tooth recession. They also report to our clinic with missing teeth. Next. So this is how the treatment was after doing a full mouth curettage. Pre and post operative, you could see the gums have got completely healed and you have got right now knife edged margin. Next. The patient reported us with depigmentation of gums. So the chief complaint was he was complaining about black gums. On oral examination, I found that there was dark pigmented gums and there was thick biotype. So what we planned was let us do the depigmentation of gums with diode laser. We could also have done the depigmentation with either scalpel or laser, or you have other electrocautery method or burst, but laser has its own advantage, so we opted for laser. Next. So this was the post-operative view after doing the diode laser therapy. Next. This is pre-operative and post-operative photograph. You could see the entirely dark depigmentation of gum has gone and it has returned to pink gums right now. Now coming up to the third case, that is your missing teeth. Patient complained of missing teeth and wanted to replace it. On examination, there was missing teeth in the left posterior region. So the plan was implant placement in the region of 3.6 and 3.7. So this was initially after giving incision, full thickness flap was reflected, osteotomy sites were prepared, and implant was placed. This is after 3 months we had placed gingival former in the first photo. Next, after keeping that for 15 days, we did abutment trial. And finally, the prosthesis was placed. This is pre-operative and post-operative photograph. As you could see, there is replacement of your missing teeth with the prosthesis. This is an endoperioral lesion. The patient chief complaint was pain and swelling in lower right back tooth region. On examination, there was decayed and deep pockets present with forceps. The treatment plan was root canal treatment followed by a flap surgery. So initially we did root canal therapy completion, and as you could see in the diagram, the healing had regressed, but it has not gone completely. So later we planned for periodontal therapy, that was open flap debridement with forceps region and doing a deep curettage. Next. So this is the pre-operative and post-operative photograph. You could see the swelling has completely gone off and the prosthesis is also placed and patient is absolutely fine and healthy. Next. Coming up to the fourth case, peri-implantitis, as we have discussed, that is inflammation of your gums and bone around implant. So patient complained of anesthetic black lines in front tooth region. On examination, there was exposed collar and inadequate attached gingiva with 2-1. So we planned for initially laser decontamination and connective tissue graft placement with 2-1 area. Next. So once we raised a full thickness flap, laser decontamination was done and we obtained for connective tissue graft from the palate. So this was connective tissue graft placed at the recipient side, sutures were placed, and now let us have a look for pre-operative and post-operative photograph. Next. As you could see, the soft tissue thickness has been increased and the exposed collar margin issue has been resolved. Next, now discussing the last, okay, that was what. Now let me have some few advice for dental students. I believe there are 5 keys to success: ambitious, focused, dedication, and hard work. So even if you have all the keys of your success stories, but what requires to keep them going is something that is called as consistency. So you need to be consistent all enough to do it. Also, I would like to share that success is next. Success is like an iceberg illusion. What people can see is only the success or the stardom and everything. But what people don't see is the dedication, the time, the sacrifices, the failure that you have given through. So always believe that any success stories has its beautiful path with along with the other side of story also. Next. Now coming up to the advice for future dentists, those who have already been completed their dentistry, for them it is next. Always make sure that when you complete your dentistry, learn from the dentist in your town. Always check for the Google reviews and then visit those clinics with your resume. Connect with other dentists on social media platform. Present your cases with watermark on social media platform. Join some kind of associations. Like in India, we have Indian Dental Association of membership present at every city or town wherever you stay. Keep upgrading and learning, that is, attend conferences and courses. Keep doing extracurricular activities like article publication, webinar presentation, and book publication. So, coming up to the last part, the take home message is I believe that is there are two kinds of people. One that finds opportunity in every situation, and one is the one that is gonna cry in every situation. Next. So successful people use all the failure bricks as a part to go up, and the ones who are unsuccessful, they use all the failure bricks and they keep on their head. Next. So always make sure you focus on the solution and not the problem. Always remember there is no shortcuts to success. Every success story started with a dream. So for that, you have to dream before your dreams come true. For that, you need to believe in yourself. Always remember, don't say I wish, always say I will. Success is formed of to set your goals, understand the obstacles, create a positive mental picture, clear your mind of self-doubt, embrace the challenge, stay on track, and show the world that you can do it. Always make sure failure is not opposite of the success, it is the part of the success. Always make sure whenever you fail in your life, just take a leap of faith and jump to the other side, and the success will be all yours. For that, you need to unlock your potential, so understand what kind of qualities you have. Always remember, the first step will always be the hardest, and the rest will be surely smoother as compared to the first one. And if you follow all this, you will start. For that, you need to start thinking, analyze, plan, try, and keep doing. And finally, the success will be all yours. So, as to end, I would like to say a winner is a dreamer who never gives up. For that, you need to dream big, you need to stay positive, and you need to work hard and enjoy the journey. So, with this, I would like to conclude my presentation. These are all my personal IDs on the social media platform. You could connect with me anytime. And if you have any doubts regarding perio, implants, and laser, I would be very happy to help you all. Thank you, everyone. Right now, I would like to give it to Dr. Zainab. If she has any questions, we could just discuss.
All right, thank you, Doctor. That was an awesome presentation. So I think we can start with our questions now from the YouTube live chat, if that's okay with you.
Yeah, that's okay. You can just let me know.
Okay, one sec. Okay, so the first question was, what is dental school like in India? And then, like, when do you start seeing patients, and what is your curriculum like?
In India, like we have a 5 years of course that is called as graduation, that is termed as Bachelor of Dental Surgery, where your first 2 years, but of this we have theoretical, and from third year we start getting patients. That is a total 4 years of course, and the last year, that is called as final internship year, we are only dealt with patients. And later, if you have to pursue post graduation, it's a 3 years of course. If interested people, they can go for it, but you have to give the special entrance test to crack it.
Okay, and then just like along the lines of dental school, what would you say was the hardest part?
The hardest part was something like to understand what field you have to choose after the graduation. Like for me, I was very much interested in surgery, but I also loved implants. So I had a confusion, like should I opt for periodontist or should I opt for prosthodontist? So something that is hardest, like yeah, not hardest, like you just have to give a lot of thought to it, like what to pursue after graduation, because you have so many options.
Okay, and then someone asked, why did you decide to specialize rather than do like general dentistry? And how many additional years did it take you afterwards?
After my graduation, it took me around 3 years to complete my master's. I always been
I can't hear you. Maybe you stepped away.
hello.
Yeah, now I can.
Right now, yeah. So right now in today's era where people are so much into Google and all, like even if a child is having a decay, they make sure they search into Google and they will go to only a periodontist. If you have anything related to gums, they will visit a periodontist. So that was the reason I felt in today's era where the things are growing so fast, you need to get into upgradation. That was the reason I opted for masters. That was 3 years of course after graduation.
Okay, and then how did the COVID situation affect your practice, and like how did you guys deal with that?
See, COVID situation affected all the dentists. It was very hard time to go for it. Like we had first wave in India. That time so clinics were all shut. There was no other option but to sit at home. We could only do online video consultations with the patient, but the treatment part could not be carried out unless and until it was an emergency. And right now things started to get smooth in January. But again in April, we had a second wave hit in India. So that also affected. Right now, I could say the things have got stable and it is coming on practice smoothly.
Okay, and then why did you decide to do dentistry in the first place? Like, did you ever consider any other professions, and why did you decide to go with dentistry?
I was very passionate about dentistry since I was a child. To be very frank, after my 12th, after getting the entrance test, I was getting MBBS seat, that is Masters of this thing.
Sorry, I can't hear you again. I think you.
Yeah, hello.
Yeah, now I can hear you.
Yeah, I was very passionate to be a dentist since I was a child. And whenever I used to visit my family dentist, he was a source of inspiration, and that is the reason he was a driving force for me to get into dentistry.
Okay, perfect. And then, what's it like starting a practice in India, and like what does that process look like, or do you work in like a hospital setting?
Yes, when I was doing my graduation and my internship, I used to have my college at 9 to 5. After that, directly I used to go to a clinic that was very close by my home, and it had a very good rating in the Google review also. So 5:30 to 9, I had attached to a clinic, so that gave me very good exposure. After completion of that, when I came into post graduation, I was working as a consultant with various clinics. So that added a lot of experience to my dentistry. So that is a reason I've also mentioned in my presentation for all the dentists that whenever you complete your dentistry, your general dentistry course, join a clinic in your town because that gives you a lot of exposure. Check where you can get maximum patients, where you can get to do a lot of work, and that is really gonna help you out.
Okay. And then how many patients do you normally like see in a day, or what are your hours like?
See, I usually have 4 hours in the morning and 4 hours in the evening. I usually see around 10 to 12 cases in a day because, but obviously, I'm lined up with surgeries. So I have one surgery that is around for 1 hour. So that is the reason around 10 to 12 are the cases that I see in a day.
Okay. And then how do you balance your personal life and dentistry, like being a dentist and a mom in a way?
Yeah, to be very frank, it's very tough being a mother and handling your dentistry. But yes, for that, you need to have a family support, and your husband, your partner should be very much understanding for that. Luckily, to be very frank, I just don't belong to a single family. I belong to a joint family where I have my mother in law, I have my father in law, and I have my husband, I have my kid to look after. Yes, family support is the reason that I'm able to balance up my both the things. And plus, I make sure that I keep them happy because ultimately, if you keep them happy, you're going to be happy, and that is what is going to reflect in your work.
Yeah. And then what would you say is like the biggest difference between like seeing patients in dental school versus like in the real world?
In the real world, yeah, there is a lot of difference because in schools, you have various departments, like OMDR department, pedo department, your perio department. So patients are already lined up in the stream form and they come to you. But when they come to your clinic, you have all this in one patient. Like one patient will come with your root canal, with inflamed gums also. He will also have extractions. So this is how it makes a lot of difference what we learned in college and what we actually practice in your clinical scenario.
Okay. And then like, have you had any cases where you've had to work with another dental specialist, and like, what does that process normally look like?
As such, I have not experienced such kind of thing, but yes, it was myself that I had helped few of dentists for sinus lift surgery because I was good at it and they were good at it in prostho. So that were my prosthodontist friend who had asked me to help them for sinus lift surgeries.
Okay. And then I know you shared like two of the books that you published. So like, can you like go more in depth about like what your books are about and like what inspired you to become an author?
Yeah, I'm right now also very passionate about laser. Laser is something I love and I'm trying to write on it. So my love for laser was since my post.
Sorry, I can't hear you again.
Hello.
Yeah, I can hear you now. I can't hear you anymore. Sorry.
Hello.
Yeah, now I can hear you.
Yeah, during my post graduation, I had my laser topic as a library dissertation. So that is the reason I developed interest in it, and that is the reason it made me to even write for it. And anything you love and you're passionate about, I feel you can really write endlessly on that topic.
Okay. And then last question here. What is one thing you wish you knew before starting dental school?
What? Can you just repeat?
Yeah. What is one thing you wish you knew before starting dental school?
One thing that
Sorry, I can't hear you again.
Yes, can you hear me right now?
Yeah, I can hear you.
Yeah, I would have just knew that dentistry is not that easy as we consider because but always it requires a lot of patience and hard work throughout your journey, and dentistry is far beyond what we think.
Okay, thank you so much, Doctor. Those are all the questions we had. And yeah, we really, really appreciate your time and all your responses.